this is Foundations of Nursing, or NUR 220 or 320. I am the instructor for both the BSN and ADN portions of this course. A little bit about myself first. My name is Christine Beck. I have been teaching at DCN for a little bit over a year. I originally graduated with my BSN from the University of Alabama in 2010. And then my husband and I moved around a bit. And I have worked in many different aspects of nursing. I like to consider myself a jack of all trades, master of none when it comes to nursing. That has included adult rehab, adult PACU, which is post-op recovery, pediatric hematology, oncology, pediatric pre. Okay, so my last recording cut off early for some reason, but we'll go ahead and keep going. So I was talking about my experience as a nurse, which has included pediatric pre-op and post-op or PACU recovery, as well as most of my experience, which is in pediatric emergency and trauma. Like I said, I've been teaching at DCN for a little bit over a year. I worked around in the nursing field for a while and then ultimately ended up deciding to go back and get my master's degree in nursing, specifically nursing education, because I love working with nursing students. It's something that I just really enjoy and I'm passionate about because y'all are usually not jaded yet and you're not burnt out and you're still really enthusiastic about the profession of nursing, which is something that is really enjoyable for me. And the other reason I went into education is because I want to share with you what excellent bedside care looks like, because that's what I'm truly passionate about is really excellent bedside care. And that's something that I want to pass on to future generations of nursing is how to do really excellent bedside care and what that looks like, because so many nurses are focused on just moving on to the next step and moving on to the next step in their career. And they forget about the patient that's lying on the bed in front of them. And that's something that I think that we really need to try to change and rectify and recognize that whenever we're treating a patient, that is a very real moment for our patient. For us, it might just be another shift, or it might be just another 10 minutes or another bed bath or whatever. But for them, it might be the worst day of their life. And it might be a day that they never anticipated and in a situation that they never expected being in. And if we can remember to have compassion for them in those moments, that is what makes a great nurse, is being able to have compassion for them and being able to show up for them where they're at in those moments and not just skating on through and not just, moving on to the next task, but actually recognizing that the time we are spending with that patient, even if it's just 5 minutes, can have a lasting impact for them. And that's something that I care very deeply about and want to teach to all of you. And that's part of the reason that I love nursing education, is because I get to teach you about that and teach more people about how to give excellent bedside care and not just hurry on to the next moment. Okay, so a little bit about Foundations. We're just going to kind of introduce the course for right now. This is NUR 220 or 320, depending on if you're in the associate degree or the bachelor's degree program. And I am the instructor for both, like I mentioned. We are going to be going through what all of your stuff from health assessment we now get to apply. And so we're going to look a lot about how to apply all of those things and how to apply all of those assessment techniques and what we need to take away from that and what is the most important thing and how do we prioritize each of those things. And that's going to be a huge component of what we're doing this quarter is prioritization and figuring out how to prioritize and learning how to look at what is the most important and what is the most important thing for each of our patients, right? And this is how you can contact me. You can reach me at this email address. I try to respond within 24 to 48 business hours. So I usually respond within 1 to 2 business days. I'm not great about responding on the weekends. I do try to check my email at least once over the weekend, but do not expect a response to me if you're sending an email to me on the weekend. Let's see. Okay. So part of what we're doing in Foundations is learning the beginnings of how to critically think, which is a brain fight, because we are going to start learning how to analyze our patients in a new way. And we're going to be learning how to start thinking like a nurse and stop thinking like a human being. And that is going to equal what I like to call the brain fight. And what this is it's a struggle that you're going to go through. And I want you to allow that process. It's going to be uncomfortable. It's going to feel weird. It's going to kind of make you lose a little bit of sleep because your brain is struggling so hard with these concepts. And I want you to lean into that and to actually allow that to happen. Because the more you allow the brain fight to happen, the better you are going to start learning how to analyze and how to prioritize and think like a nurse and actually shift your way of thinking. And that is going to be critical for you to be successful in this course, is to actually allow that shift to happen in your brain. So we're going to talk a lot about problem solving and the way nurses solve problems and how we think through the steps and what we do and how we actually apply all of those things from quarter one and what that looks like. And that's going to be a huge component of what we're doing this quarter. We're going to talk about ways we communicate with each other and ways we communicate with physicians and ways we communicate with non-licensed individuals, right? So we're going to talk about how we actually communicate in the medical world. Well, we're also going to be looking at what types of things we are concerned about. The types of things that nurses are concerned about are different from the types of things that physicians are concerned about. It's different from the types of things that CNAs are concerned about. And so we're going to talk about what that looks like and what it is that nursing specifically is concerned about. This is not an easy class. This is going to be very different from your other courses that you've had before. This is not going to be the kind of class where you can just look at the PowerPoints and do well. You need to be coming to class. You need to be reading your textbook, especially the procedural stuff. I am not going to be taking class time and spending that telling you how to perform a procedure. I expect you to get that information from your textbook and from the skills videos, which I have a link that I will show you. And we're going to go over all of this, right? But that's not going to be something that we're going to be doing in class. So there is going to be prep work that you have to do outside of class time. Also, a lot of the content you're going to be covering in SIM is not going to be stuff that I'm going to cover heavily in didactic. Didactic is going to be focused on the theory and the prioritization, not the actual performing of things. Same with your skills lab, right? So the clinical and the SIM and the skills, that's where you're going to be doing all the things. In class is where we're going to be talking about why we do the things and why we care about the things that we're doing and how we apply that. And it's definitely the theory side of this class, not the practical side of this class, right? That's going to be what you do with the other portions. There's a lot of information in this course. As you have already discovered, the accelerated program is a very intense program. You've got to be doing a little bit each day. It is not going to be sufficient for you to be trying to play catch up in week 10. I need you to be studying a little bit every day and staying in the work and actually doing all the work and putting in the time in order for you to be successful. Past medical experience will be helpful because you're going to feel comfortable with some of these things that we're going to be talking about and some of the skills you're going to be doing. That is going to be something helpful for you. However, if you do not have any previous medical experience, that is 100% okay. I had no previous medical experience when I went into nursing school, all right? And I have been a practicing nurse for over 10 years now. And there's absolutely nothing wrong with coming into this field without prior medical experience. It might make you feel more comfortable with patient care if you do have that. And if you don't have that, that is also totally fine. Both of those are 100% okay. Practice does not necessarily make perfect, but it does make habit. And it makes you feel more comfortable with what it is that you're doing. And that's why you need to be practicing the skills and practicing the checkoffs and practicing all of the procedures that are in the textbook, is because that practice is going to allow you to learn the habit that allows you to be more comfortable. You also want to make sure that you are studying in a way that is giving you the results that you want, right? Like, that's important, is to be able to actually be studying in a way that is achieving what you need it to be achieving. If your studying habits are not successful, come talk to me or form a study group or find another way to study and change up how you're doing it to find something more palatable and more successful for you. There are multiple teaching methods during this class, right? So we have our traditional lecture, that's the didactic that you get from me. You have your HESI case studies on Evolve, my experience, your experience, as well as all of the clinical and sim and skills labs that you're going to be doing. That's all components of this. I am absolutely available for you if you need help. My office hours are on Tuesday and Wednesday afternoons. If those times don't work for you, just email me and I'm happy to set up a time with you, especially since we're in this virtual setting. Just shoot me an email and we'll set up a virtual office hour session where we can meet and go over stuff. But please, please reach out. Do not wait until you are super struggling and not succeeding before reaching out. Reach out well before then so that we can talk about how you're studying and what it is that you're doing. Do not suffer in silence. Reach out to me, make an appointment. If you're trying to catch up at the end of the course, you're not going to be able to do that very well. You really need to be getting ahead of the game and actually asking for help early rather than later. Study groups are excellent. For my previous courses, I offered a basically, so I'm a huge nerd, and if you know anything about Harry Potter, you'll know that they have what are called common rooms in Harry Potter. And so what I did was I just created a Blackboard Collaborate common room for my students where they could go and have a meeting, and that was always open. And if you want me to do that, I'm happy to set up a room where all of you can kind of have study sessions in Blackboard Collaborate, and it's just constantly open. So y'all can hop on there, and I'll set one up. But you can just hop on there and, meet with each other and turn on your videos and audios and actually be able to be talking with each other. And that'll just always be open, and you can go into that room and study together whenever you need to. During lecture, right, when we're in didactic and we're doing our virtual sessions, I do ask that you turn off your audio and you turn off your microphones, because that is going to allow us to have better quality of the videos. You'll notice that my computer is terrible and it does not handle virtual things very well. And so I will almost always have my video off so that you get the best quality video possible, or audio rather, and presentation. You do need to be coming to lecture. This lecture course is highly discussional. It is really, really based in the things we discuss in class. And you need to be in lecture in order to be successful. That's just the bottom line. There are also supplemental materials that you need to be getting your information from, like the procedures that are in the textbook and the Elsevier video that you need to be studying. Again, I am not going to be going over those in lecture. That is your responsibility outside of class. For your lecture notes, pay attention to things that are in bold red text. If it is in bold red, you need to know literally everything there is to know about those topics, including why they are in bold red. So why is it that that thing is important? Okay, those things are going to be exceptionally important for you to understand and grasp. And you can be guaranteed that you're going to be tested on something that's in bold red. Your textbook is going to be a supplemental resource. It does help. The textbook is going to help reinforce the concepts that we talk about in class. So whenever we go over something in class, we're going to go over it in the theory way, right? And we're going to talk about how to implement that and how to prioritize it. But then I want you to go to your textbook and read about what we discussed in class so that you can have a deeper, more thorough understanding of what we discussed in lecture. Go through the questions at the back of each chapter. They're going to help you. Read the procedures in the textbook. I cannot stress that enough. You need to go over the procedures in the textbook and in the videos. Also, your Red HESI book, you have a Red HESI book that is the comprehensive review for the NCLEX examination. That book has a lot of information about prioritization. It has a lot of HESI testing questions, which is very, very helpful study tool. Also, your NCLEX, your Saunders NCLEX review, Saunders NCLEX textbook. Those two tools are the ones that the students in the past have said were extremely helpful for studying for the HESI. Again, please reach out if you are not sure of how you're doing in the class or if you're feeling weak, right? Reach out and ask for help early so that I can actually help you and you can be more successful. This is an example of what one of the slides would look like. So if we're talking about pre-op nursing assessment, we're going to talk about what we're doing when we gather baseline data. We're going to get a physical exam and an interview. We're going to do a patient identification. Well, why do we do a patient identification in pre-op nursing? To make sure we have the right patient. Why does it matter if we have the right patient? To make sure we're doing the correct procedure, right? So you can notice how those things in red are the things that are more important and explain why the one thing is important. When we're doing data assessment of a pre-op patient, we're looking at lab review. Well, why do we care about labs when we're doing a pre-op patient? Because we need to know whether or not they are actually hemodynamically stable in order to undergo the procedure that they're about to have. If they don't have the clotting factors, they are not going to be hemodynamically stable and they're going to bleed out on the table. If they if they have too high of a white count, right, they're going to be at risk for increased infection if we are performing a surgery on them. So you notice how looking at these things, you can see why the red things matter more than the others. I am going to do my best to stay on schedule. There are going to be times when we are slightly ahead or behind the content. If I haven't delivered it to you, you're not going to be tested on it yet. So that'll just be pulled from that exam. You're only going to be tested on the stuff that we've actually covered in didactic. Some of this is going to require self-studying. The procedures, the skills, otherwise it's pretty rare that you're going to have that self-studying. I am going to do my best to make this relevant to you. I incorporate a lot of stories from my personal nursing practice to help try to tie all the concepts together to you and make it relatable and make it very real life, right? This is a social profession. It's a curious profession. I want you actually asking questions. I want this to be something where we can discuss. Whenever you want to bring up something in Blackboard Collaborate, just use the raise your hand button and I'll call on you. And then you can, verbalize it, or you can type it in the chat bar. I try pretty hard to be on top of that. All of the assignments in the syllabus must be completed in order to pass the course. Literally all of them. If you do not complete any one, you will have an incomplete and then a failing grade. So especially if it's a pass-fail assignment and you didn't do it, it'll actually give you a 0, which means you will fail the whole course for a pass-fail assignment, which you literally just have to do. So make sure you are staying on top of the syllabus, which we will go over in a moment. All right, these are your assignments. Again, we're going to go more in depth into the syllabus and talk about each of these. You have 4 course exams. These are worth 55% of your grade. Then you have 4 course quizzes, which are only worth 5% of your grade because you can take them as many times as you want. And because the intention of the quizzes is to help you be prepared for the exams. So the quizzes are really an exam prep tool is what they are. And you can take them as many times as you want prior to that exam to achieve the highest grade possible. And they are worth 5% of your grade. And then you have the HESI exit exam, which is worth 20% of your grade. All of these things, so the exams, the quizzes, and the HESI, have to average a 78% in order to pass the course. If you do not achieve a 78% in these things, you will not pass the course and you will have to repeat. And then after those things, we have a couple of other evaluation tools that kick in to be supplemental to your grade. So you have an individual care plan. That is actually 3 assignments. So you'll have 3 grades for those. And total, they're worth 15% of your grade. You're going to do 1 care plan 3 times, basically. And we'll talk about that in a moment. You're also going to do a patient safety paper, which we'll go over, and you'll do HESI case studies on Evolve, again, which we will go over and touch more on. And I know all of you did HESI case studies last quarter in quarter 1, and we're going to be doing more of those this quarter. And those will be assigned between pharmacology and foundations, so it'll cover both of those courses. And then your pass-fail assignments. You have weekly NCLEX questions. Again, you can do these as many times as you want. These are just pass-fail. I highly recommend reading the rationale. These are all taken from Evolve HESI questions. And so it's literally a study tool for the HESI. And you're going to be able to do those. They're going to close each week. And you're going to be able to do those in that week as many times as you want. And I really, really want you looking at the rationale, not just the rationale for the questions you got wrong, but also the rationale for the questions you got right, so that you understand why you got them correct. And that's actually super important. Then you have a HESI practice exam that will be due at the end of the quarter. That will be set up like a HESI. So it will be set up so that you have a timed exam, and you have, I think it's pretty long. I want to say it's like 80 questions, but I want you to actually use that as a mock HESI and use it to test your knowledge. I highly recommend trying to get at least a 75 to 80% on that practice HESI, and if not better, right? Ideally, I want you in the 80s on the practice HESI to make sure you're feeling comfortable with taking the HESI and feeling prepared for that. That is another thing that you can take as many times as you want. It will be available to you the whole quarter. Again, read the rationale for why you got questions correct and why you got questions incorrect, so that you're understanding how you're answering questions, because that's a huge component of testing, is how are you answering the questions why are you selecting the answer you are. You also have the skills lab, the sim lab, and your clinical experience. All of those are pass fail. You have to complete them. If you fail any component of those, you will have to repeat the entire course, including didactic and all the other components. This is the link to the Elsevier Foundations videos. You are required to do these. You have a couple of them assigned each week. Again, that is your responsibility. It's not something I'm going to be going over in didactic. Okay, now we're going to go over the syllabus. Let's see here. I'm going to pause this recording real quick while I get this up. Okay, because I am the didactic instructor for both ADN and BSN, I'm going to go over the ADN syllabus first, and then I will go over the BSN syllabus. If you have any questions about that, just shoot me an email, and you can just tune out if it's not your section. So ADN first, NUR 220. We meet on Mondays and Tuesday mornings on Blackboard Collaborate. These are our course objectives. These are your required textbooks. You are required to have a NANDA textbook. I actually need you to have that. There is the very first page of the NANDA textbook is all of the actual NANDA, so all of the nursing diagnoses. You need to bring that with you to every single class, because we are going to talk about nursing diagnoses every single class. So you have to have that with you. We're also using the APA manual for your papers that you're going to be writing. The 10th edition, you have your lab book, your Perry and Potter and Potter and Perry books as well for clinical skills, and then the actual fundamentals. I need you to do your syllabus review. I actually want you to complete that today, Monday, the 6th, Monday, July 6th, as a record of your attendance for Monday, July 6th. So go ahead and complete that today. It is on the assignment Dropbox, which I'll show you in a moment. So just hop on there and acknowledge that you have reviewed this syllabus. We talked about this a little bit already, the course evaluations. You have to achieve the 78% of the items that are in bold, which are your exams, your quizzes, and your HESI, before all of the other points will kick in. And then you have the individual care plan, the patient safety reflection paper, and your HESI case studies. Your pass-fail assignments, we already discussed. Oh, except for HESI remediation. So if you get lower than an 850 on the HESI for your composite score, you will need to complete, it is 1 hour of remediation for every 25 points under 850 that you score. And that has to be completed as soon as possible, or else you will receive an incomplete for your grade. And if you haven't done it by this first, I believe it's week of the following quarter, you'll actually get a failing grade. So I want you to do that as soon as possible if you do have to do any remediation for the HESI. And that's pass-fail. It does not boost your grade. It doesn't do anything for you except for make you feel more comfortable with the material and prepare you better for understanding it and recognizing what you got wrong. So there is a lot you gain from it in terms of your understanding, but it does nothing for your actual numerical grade in this course. Exams and quizzes will all be online. They are going to be delivered electronically. They will all be delivered at the same time. For the ADN cohort, that will be on Mondays at 11. For BSNs, I will keep you posted. I will have an answer to you by the end of the week for what day and time your exams will be. All exam grades are final 7 days after they are posted. There is one HESI attempt at the end of the quarter. That exam consists of 55 questions. No retakes. I will be signing off your HESI binders as well. That is from quarter one. So I will be signing off your HESI binder from quarter one, and you're just going to send me, I'll have an assignment Dropbox where you just drop in there your screenshots or a PDF document of the pages you filled out from your HESI binder or the HESI binder pages electronically, and just fill that out and complete it and drop it in there, and I'll take care of it. Your HESI case studies are going to be found in Evolve. I'm going to hop over there very briefly. And all of this so far is true for both BSN and ADN. So this is covering both courses. Okay, so what this looks like for your HESI case studies is you're going to go to the course calendar. Whenever you go to the course calendar, they're automatically going to be assigned to you, and you'll have one of them due each week. So you'll do pain, mobility, skin integrity, and then if you go to August, you have more, including your dosage calc exam, and your fundamentals assignment exam, which is the practice exam you're going to take, and then the pharmacology one as well. All of those will be due prior to the HESIs that you take. You do have to complete all of these in order to pass the class. They are pass, fail, okay? Back to the syllabus. Sorry, no, that's not correct. They are worth 2% of your grade, so they'll be averaged and plugged in. And then you have NCLEX questions that are due each week. The way this is done in Foundations is through assignment Dropbox. So I've actually already programmed and plugged in all of these for you. So if you go over to your assignment Dropbox under Foundations, that's not what I told you to do. Hang tight. Okay. If you go to the assignment Dropbox, you'll notice all of these lovely things we have here, which we'll go through. Your NCLEX questions. This is pass fail. You do have to do them, but you can do them as many times as you want. So you'll go in here and you'll click, and they each have their due date on them. They will not be available after that date. And then you'll just go through and complete each one. And each one, I believe, is 25 questions, something like that. That might not be true. Might be shorter than that. But each one has a number of questions and the rationale. Again, I really want you to actually read the rationale, including if you got them correct, because I want you to understand how you're answering the questions that you're answering. All of these are pulled from Evolve. So all of these are pulled from the Evolve Who Makes Your Textbook, Who Makes the HESI. So this is studying for the HESI when you go through these. And then Skills Lab is pass-fail. Fin Lab is pass-fail. Clinical is pass-fail. You have to do all of them. Missed assignments have to be completed within 48 hours of the original scheduled time or due date. If you do not complete it within that time frame, you will receive a 0 for that assignment. So it'll be a 0. So if you have anything that you missed, you absolutely have to get it done within 48 hours of the original due date. If you have an excused absence, that has to go to Director Dr. LeClaire, Dr. Andrea LeClaire, who is the director of undergraduate nursing here at DCN. And she has to approve that excused absence in order to not receive a 10% deduction from your grade. Let's see. And then if you miss more than 20% of class, I do take attendance each day during didactic, and you actually have to be participating in the class in order to get credit for attendance. So that means answering questions and being a part of the discussions that we'll be doing. If you miss more than 20% of the course, that will actually be a 1-letter grade deduction from your final grade. Policies. All right, let's talk course calendar. This is the wrong course calendar. That did not get updated. I apologize for that. We'll go through the correct one in a moment. Okay, so this is your rubric for the ADN care plan. I don't think there's any difference between the ADN and the BSN care plan assignment. You will do 1 NANDA for each care plan, and then you're going to do 3 total care plans. You are going to be writing these on yourself because this is something you're actually going to have 2 weeks for each one, so you can actually implement it and then do a legitimate evaluation based on your outcome and how well you did for it. So come up with something like, I don't know, maybe sleep improvement or improving your dietary habits or stress reduction. But come up with something that actually is pertinent to you. And then we'll talk about how to do a care plan in class as well. We'll actually go over that. And then you cannot do more than 1 risk-4 NANDA for the entire 3 care plan assignment. You can only do 1 of those if you're going to do a risk-4. And then you do need to have your related to and as evidenced by statements plugged into your NANDA, which I'll show you. Your data needs to include 2 subjective and objective data points. You need 2 goals in SMART format. You need 3 interventions per goal. So if the best way to do this is to go goals, 1, 2, 3, 2, 2, 3. Interventions, 1, 2, 3, 2, 2, 3. Rationale, 1, 2, 3, 2, 2, 3. Evaluation, 1, 2, 3, 2, 2, 3. So every single intervention does need to be evaluated with the statement met, partially met, or not met, which is a total of 6 evaluations per care plan. This is probably the thing I see done incorrectly the most often, is people only evaluate the goals and they don't evaluate the interventions. But the point is actually to see how well each intervention helped you to achieve that goal. So you have to evaluate each one of those. So a total of 6 evaluations per care plan. This is your rubric. This is how I'm grading you. If you do not follow the rubric, you will have points deducted. Any citations or references need to be in APA format, including in-text citations for your rationales. Okay, so all sections have to be complete. Again, this is your rubric. This is how I'm grading you. I literally go down and mark points for each one of these and how thoroughly you did them. We'll talk more about the care plans in depth later. And then for NUR 220 for foundations, this is your patient safety paper. So you're going to identify some type of safety issue from a clinical experience that you have been a part of, or a VSIN, or some clinical safety issue that you care about if you have not had an actual clinical experience yet. You're going to talk about its relevance to nursing. What intervention will be incorporated into your practice? That actually has to be a component of it, is what you're going to incorporate into your practice. And then a conclusion paragraph. Remember that your introduction should be like a preview, and then a conclusion should be a recap of what you discussed. You do have to use 1 peer-reviewed journal article to support your findings, and APA guidelines are included. This is due week 8 at the end of week 8, Sunday by midnight, in the assignment Dropbox. This is your rubric. Okay, and now we will go over the BSN syllabus, and then we'll go over the assignment Dropboxes for everybody because they all look the same. This course calendar is completely wrong. Please refer to the master schedule and the ones posted on your individual pages for your actual class times. Add drop date is July 12th. Withdraw date is August 16th. So that's a Sunday. Please contact me if you are considering withdrawing. I would like to, talk you through what that looks like. These are your required textbooks. Your NANDA textbook is required. I need you to actually bring the first page of the NANDA textbook to every single lecture because we are going to talk about NANDA every single lecture. That first page has a list of all of the NANDAs, and that's a tool that we're going to be going through the entire quarter and using to prioritize our patients and go through that prioritization skill. Well, I believe you're on the 10th edition of the APA manual, actually. Your grading evaluation criteria that we already talked about. So your 4 course exams, your 4 course quizzes, and the HESI, you have to achieve 78% on those bolded items in order to pass the class. And then you have your individual care plans. There are 3 total care plans worth 15% total. So you'll get each one is 5%. And then your patient safety paper and your HESI case studies. HESI case studies we already talked about on the Evolve section. Your NCLEX questions are your weekly assigned sections that we already talked about a little bit. Those are under the assignment Dropbox. Again, they are due Sunday midnight each week. You do need to complete those. They are pass-fail. HESI remediation, if you get lower than that 850 composite score, you do have to complete 1 hour of remediation for every 25 points below 850. Oh, that should include your HESI practice exam should be on here as a pass-fail assignment as well. Let's see. Case studies, practice questions, exams, and quizzes. Exams will be given electronically online through Blackboard all at the same time. All grades are final 7 days after they are posted. You have the HESI quiz on Evolve and the HESI practice exam on Evolve that you can use to practice as many times as you want. Those must be completed prior to HESI. HESI remediation has to be completed if you score below an 850 in order to pass the class. That is a pass-fail component of this course. Final grades cannot be completed unless you have done the HESI remediation. All of this we've already talked about because it's the same as the ADNs. Okay. This course calendar is correct for both the ADNs and the BSNs. So we're going to go over this. The first week, we are obviously doing class introduction, and then we're going to start into the nursing process today, and then we'll get more into it for the rest of this week. Oops, go away. Oops, sorry. Your learning style and bio is due Sunday by midnight. That is in the assignment Dropbox. You also need to do your syllabus acknowledgement form. I want you to complete that today as your attendance. And then you'll be doing your skills lab acknowledgement form as well. And then we'll cover the rest of the nursing process later in our second lecture this week. Next week, we'll dive into vital signs, legal ethics, and medication administration. And then your first case study is due at the end of next week, as well as your first NCLEX questions and your first care plan. So that individual care plan number 1 is due at the end of next week, end of week 2. And then your first exam is in week 3. That will be covering all of the sections of this first unit, right? So nursing process, vital signs, legal ethics, medication administration, all of those are covered under exam 1, which is time to be posted. I'll have that to you by the end of the week. And then you'll have in week 3 your case studies and NCLEX questions. Your quiz 1 is due before you take exam 1. So it's always true. Your your quiz for that unit will always be due before the exam for that content. And again, you can take those quizzes as many times as you want. They are pass-fail. Let's see here. Your second care plan is due at the end of week 4. In week 5, you'll have your quiz 2 due and your exam 2 due, and that's when we'll be. All right, so picking back up where we were talking about week 5, in week 5, you do have your HESI binder check off and your exam 2, as well as your quiz 2, because quizzes are always due before your exams. Let's see. Week 6, you have your third care plan due. So notice that all of your care plans are due prior to the drop date, because the drop date is always at the end of week 6. Week 7, we have NCLEX questions, quiz, and exam. Week 8, your safety paper is due. Week 9, we've got another quiz and an exam. Week 10 is your HESI, and then in week 11, we'll have some type of class activity. Okay, here is the scoring rubric for the INUR 320 course, the foundations. Again, I don't think there are any differences between ADN and BSN for this. They should be pretty much the same. And then your patient safety paper. For the BSNs, for the patient safety paper, your APA paper does need to include a research component. So you are going to have some research that is involved, as well as the intervention that is going to be incorporated into your personal practice. So don't select something that management has to change, right? It has to be something that you personally can change in your practice in order for that to be a valid intervention. Let's see. You do also need to have a minimum of 2 peer-reviewed journal articles for your paper to support your work. And the safety issue, the summary of the research is going to have evidence-based intervention that is supported by research, and then the improvement statistics from this research that you have found for that intervention, showing that that's a specific, and then discuss the intervention itself, and then your conclusion. Again, your introduction is going to be the intro to the paper, and the conclusion is going to be the recap, right? So talking about what you're doing and then talking about what you're not doing. All right, let's talk a little bit about what the Blackboard side of things looks like. I'm gonna, nope, just kidding. Try to view this as a student. There we go. All right, student preview. Farts. Hold on. Hang on a second while I get your course back. And then we'll go through all of the assignment Dropbox components that you will need to be paying attention to. Nope, that's wrong. Okie dokie. So if we go over to, I'm going to put this in student view. Okay, so if you go over here to your assignment Dropbox, we already talked about the NCLEX questions. This is where you'll find your course quizzes. You have quiz 1 that is already available to you. Each one will pop up after the unit has ended previous to that, and then the next one will open and you'll be able to take it. Quiz 1 is always due before the scheduled examination time for test 1. And you can take it as many times as you want to achieve as high of a grade as possible. These are worth a percentage of your grade. I believe it is 5% per the syllabus. Again, take them as many times as you want, right? To get the highest grade possible. And then if we go back to our assignment Dropbox, this is where you'll find all of your course exams. Your individual nursing care plan assignments will be under INCP. you notice that you have both the assignment and the template under here. So this template is what I want you to use to fill it out. Just type it directly in there. It should not be handwritten. It should all be typed. And then the assignment itself with the rubric is up above. And then you have your drop boxes for your INCP 1, 2, and 3 due at the ends of weeks 2, 4, and 6 respectively. And then if we go back to the Dropbox, you also have the patient safety paper. This looks a little bit different for the ADNs versus the BSNs. For BSNs, you have this patient safety primer that I do want you to read and incorporate, and then your assignment. And for the ADNs, it's just your reflection paper. Learning style bio that is due by 7/12 by midnight. These are your instructions for that document. And then syllabus review form, again, I want you to complete that at the end of day 1 to be able to post attendance. So that is Monday, 7/6. You need to complete your syllabus review form. And then you can find clinical documents and foundation lab activities. Your clinical documents all need to be filled out by the end of the quarter. So that includes your assignment packet, your completed evaluation packet, and then the clinical acknowledgement forms, which are several. So you have all of these clinical acknowledgement forms, which all have to be signed off prior to the end of the quarter. And then let's see, every now and then I'll use the discussion board if I post something that I feel is pertinent to you. I might have that pop up every now and then. But for now, let's go ahead and get a little bit into our first lecture. Okay, so hopefully this is showing you the PowerPoint for the nursing process. That's what this should be. So first we're going to talk about what the nursing process is. And I know you got this in quarter 1 in health assessment, but we're going to go over it again, and we're going to go a lot more in depth. We're going to take most of this lecture to actually continue covering this. So we're going to talk about what it is, and what the nursing process is how to do nursing. That's what we're talking about, right? We're talking about the actual act of nursing and what that looks like. And we're talking about how nurses decide what to do and what actions to take. And that's really what this is about. All right, and I apologize in advance. My computer is being incredibly slow, so if there are bugs, I'm sorry. Our objectives, so we're going to be discussing critical thinking skills, the professional standards, and the relationship of the nursing process to critical thinking. So tying all that together, right? This is the entire point of nursing school. So we kind of touched on this already. The goal is to stop thinking like a human and start thinking like a nurse. This is what separates nurses from technicians or non-licensed practitioners. We use knowledge and experience, right? We are learning to question and to explore different perspectives and interpretations and find solutions that work for an individual patient. Not every solution is going to work for every patient. Sometimes we have to come up with new things. Actually, all the time we have to come up with new things, a new way of doing things. And we have to evaluate the clinical situation that is happening in front of us and then recognize what's going on and interpret the meaning and then respond appropriately. And that is the whole point of nursing school, is to stop thinking like humans and start thinking like nurses. All right, so critical thinking. I want you to kind of pause this and think about what you think critical thinking is. So pause it, just kind of take a moment and think about what critical thinking really is. Like, what does that mean? One way to define this is a systematic, logical openness to question and reflection. It's a continuous process. It is unique to each patient situation. You can find more about that in Table 15-1 and 15-2, which we'll discuss a little bit more about it, but we're going to go more into it. So we have two components. We have the skill of generating a set of information. That is what you learned in quarter 1, right? Health assessment is all about gathering a set of information and gathering this large set of data. Now what we need to do is filter that into something meaningful. we are going to use our physical exam, right? So we're going to take the physical exam that we've performed, and we're going to use that to come up with a decision and figure out what to do next. We are going to keep using the previous courses and information each quarter and build on each new thing. So one of the problems with nursing school, and something that a lot of people struggle with, is that you can't just brain dump the quarter before, right? You have to hang on to it and actually use it and apply it to the next quarter. And each quarter, you basically dig a little bit deeper, and you get a little bit more intense, and you get a little bit more in depth, and you learn more, and you apply more, and you think at a higher level. And that's our goal for you, is for you to think at a higher level each and every quarter. So last quarter, in quarter one, you learned the skill of generating a set of new information, right? Because you learned about health assessment, how to do a physical assessment, how to do a review of systems, how to gather health history. All of that is going to be something that you're now going to take and use as this large set of data. And then again, we're filtering it into something meaningful because we have a whole bunch of information. But we have to try to figure out, okay, what is it that we really need to know from this? Like, what from this is most important? And then we're also going to develop this habit and ability to use that skill to guide our behavior. Because we don't just have a set of information, we need to do something with it. Because as nurses, one of our major goals is to leave our patient better than we found them, right? That's always our goal in nursing, is to leave them better than we found them. At the end of the day, at the end of the shift, at the end of our interaction with them, they should be better off than when we walked in the room for the first time. And so we want to use this habit and this ability and this critical thinking component to guide our behavior to actually lead us to action that will benefit our patient. All right, so we have our professional set of information. We know we have subjective data. Subjective data is going to be information from the patient's point of view, right? This is patient reported. It's their presentation of the disease. It is their perception of what's going on. It is their perception of the condition, of their condition. We need to categorize our data that we got, our set of information, right, in order to get to a point to where we can make a decision. We need to do something with the data. We don't want to just have data. We want to do something with it. So we have subjective data. This is what they are telling you, what they are experiencing. This is all from the patient's perspective. And then we have our objective data. This is measurable data. It's collected from the patient, yes, but it is measurable. And it is things that we can verify. So what did you actually visualize? What testing information do we have? Because that is a component of objective data. What are we trying to achieve, right? So with our testing data, with our objective data, we have observation, which is our physical exam that we're going to perform. Then we also have testing. That includes laboratory and diagnostic testing. All of that's going to be measurable data that's collected from the patient to give us our objective data set. One way you can think about this is something that a student came up with a long time ago is, as far as subjective data, it might be lies. I don't know, right? If that is how you feel about that statement, might be lies, I don't know. It's subjective data. If it's stuff you found, so stuff you do know, that is objective data because you found it, you observed it, you know it for a fact. Therefore, it is your objective data. Remember, our professional set of information, the point of this is that we're trying to achieve something. There is a problem with your patient and you are going to address it. And we are going to use this professional set of information in order to guide our actions in what we are trying to achieve. All right, so now we have this professional set of information. We also have certain levels of evidence within this set of information. And what we're trying to do is we're trying to gather enough data to compel us to action. If we have 1 point of data, this is not anywhere in your textbook. This is something that has been generated by brains smarter than my own. If you have 1 point of data, that is something that is curious, right? That's like, hey, I notice that my patient has chest pain. That's interesting. That's curious. That makes me curious, right? If a patient comes in complaining of chest pain, that's pretty curious. I want to know more about that. I need to have more information to compel me to act, right? If I have a second data point, I also notice the patient is short of breath. Okay, now they have chest pain and they're short of breath. That's getting interesting. I have two data points that make me think this is interesting. There might really be a problem here. I still want to find more information to compel me to act because I want to know that I have a problem, not just think I have a problem. And so now I'm going to do maybe some vital signs, and I discover, oh, they have a low oxygen saturation. That is compelling, right? That third piece of information tells me, oh, I have a respiratory problem because they have chest pain and they have shortness of breath and they have a low oxygen saturation, which points me to a respiratory problem. That is a compelling bit of information. I have those three data points. So the whole point of this is that we have due diligence to make sure that we have a problem, right? So the reason that we want to get to that third data point is to tell our brains, yes, this isn't just something I suspect. No, this isn't just something the patient told me. I actually have a problem and I need to do something about it. This is how you apply your head to toe exam. So we need to do a focus exam in order to be compelled to do something about a particular problem when I find something wrong, right? So if I find something wrong with a patient, we know that we need to do something more. If the patient says they can't breathe, go listen to their lungs, measure their lungs, do an exam, do a test, do something to give you more information to compel you to action. We have several different ways of gathering this. We have our subjective data and objective data. Those are our methods for gathering evidence to compel us to act. All right, using that skill to guide our behavior. This is the whole point. We want to do things as nurses. We need to do things as nurses. Risk management is one of the major things that we do as nurses. So we are finding out that something's wrong, and then we're going to do something because we want to leave our patients better than we found them. So with risk management, we're going to identify vulnerabilities in our patient. So try, especially in this course, to focus in on physiological or psychological vulnerabilities. These are things that we do that place the patients in harm's way. So they're consequences, right? If we have vulnerabilities, these are consequences of several things. They are consequences of stuff I do to the patient. They are consequences of stuff that the doctors do to the patients, drugs we give, procedures that the patients have done. These are all consequences, right, that lead to these vulnerabilities. And then these are going to be things that place our patient in harm's way. Consequences are really just outcomes. If we place an IV placement and introduce an infection, a drug versus a poison, that's just a dose, right? So the only difference between a drug we give a patient and a poison we give a patient is the dose we administer, and that's it. There are inherent risk exposures in medicine with radiology, right? When we do an x-ray, we have radiology exposure due to the test we're doing, and it's a risk versus benefit thing. When we think about how we evaluate what we're doing and whether or not we know whether we need to act, we're going to think about this normal versus abnormal and expected versus unexpected outcomes. Okay, so when we are thinking about how to prioritize, the way I want you to think about this is using this graphic. So you'll notice that we have normal and abnormal on the top row and expected and unexpected on the bottom row. We're going to also divide this into high urgency and high importance versus low urgency and low importance. When you think about your normal outcome, think about these as not urgent, or important. So why waste your time, right? We don't need to worry about these right now. Abnormal, this is going to be on our axis for not urgent or important. Abnormal is going to be urgent but not important. AKA, these are distractions, so we need to ignore them. Yes, they're abnormal. Yes, they're urgent. We need to deal with them, but they're not important. We don't need to deal with these right now. They're distractions. We need to ignore them in our prioritization. Our expected outcomes. These are important. We need to pay attention to them, but they are not urgent. So we're going to prioritize and prepare to work on these next. And then we have our unexpected, which is going to be urgent and important, and we need to focus on these first. The first thing we're going to do is pay attention to the unexpected outcomes because those are urgent and important. So if we are looking at this graph, this is going to be high importance is going to be our bottom row and low importance on the top row. High urgency is going to be the right column and low urgency is going to be in the left column. Whenever you see a test question that says, what should the nurse do first? Divide them into this little graphic, right? And think about whether or not it is one of these outcomes. That's going to help you figure out which one you need to prioritize and what you need to focus on first. All right, so how doctors think versus how nurses think. We're going to get a little bit more into this. So we as nurses are trained to be looking at things critically. We are trained for critical thinking. We are very different from the people that we are working with. We are trained to do critical thinking. Doctors are actually trained for something called differential diagnosis. These things are different. When a doctor is looking at what's going on with the patient, they are looking at what the most likely problem is. So what is the most likely thing that they are faced with? Okay, we're going to probably think that it's that, but we have a few other things that we need to rule out. We also want to think about what it's not likely at all, right? This is something that the physician considered. They're not concerned about it. It's not that. And then the thing that they need to rule out. So based on the history and the risks, this is something we need to rule out because it could be a potential serious problem for our patient because they're focused on what can kill their patient, right? So if they're looking at what can kill their patient, they're looking at, okay, this is the most likely outcome. This is not likely at all, but I need to rule this one out so I don't get caught off guard and my patient dies from something that I just did not pay attention to. So when we think about doctors and nurses communicating and talking to each other, we have all seen and witnessed and experienced situations in which that communication was less than inspiring, right? We've all seen situations in which we're like, that's not really how that should have gone down. When you are communicating with a physician, I want you to keep this in mind, that their goal is differential diagnosis, right? That's their whole way their brain is focusing and thinking, is what can kill my patient? I need to rule that thing out. Versus nurses thinking about the human aspect and the human experience of medicine. This is a graphic that is an example of differential diagnosis. So the patient lost consciousness. What happened, right? Did they lose consciousness? Yes. Okay. We need to consider these things. No. Was it true vertigo or was it an ill-defined dizziness? We don't really know what's going on. Elderly versus young. Were there CNS symptoms? Was it a TIA? Was it vertigo because of movement? Was it hearing loss or tinnitus? We're going to consider some of the bigger things like acoustic neuroma or Meniere's disease. This is all a differential diagnosis pathway for syncope, right? The patient fainted. That's what happened. They had syncope. They had a syncopal episode. And the physician's role is to go down this differential diagnosis chart to figure out what the actual diagnosis is. This is cause and effect. It's very, very linear. And this is how doctors make diagnoses. This is the difference between nurses and physicians. Nurses talk about things in terms of the context of the patient experience rather than in the yes, no. We are focused on the patient's experience of this. How did this make you feel? What was this like for you, right? Versus the physicians thinking about this in a very linear progress. So think about this when you're trying to communicate and talk to doctors because it's going to help put you on the same page as them, and y'all will be able to communicate much more effectively. Where our strengths lie. So our strengths are very much so different, right? Doctors are extremely good at identifying and labeling disease. They are good at knowing when to order specific exams, diagnostic studies, how to interpret those things, the prescription of an intervention, how and what to prescribe. Antibiotics are an amazing example of this. You are going to be learning this quarter in pharmacology about the wide variety of antibiotics and how those can be differently prescribed and when those would be used differently. ultimately, as nurses, your job is not to prescribe an antibiotic. Your job is to know how the patient is going to respond to the antibiotic, right? In terms of their side effects. What does the patient need to know in order to take the antibiotic effectively, in order for it to be healthy for them? Physicians are trying to eliminate a problem, right? The goal of the doctor is to eliminate the disease. That's their entire goal. The nurse's goal is to resume independent function to the greatest possible level. I want to leave my patient better than I found them. In order to do so, I'm going to focus on their experience of the disease. How has this affected you? And their response to the treatment. Was it an anticipated and normal response to the treatment, or was it unanticipated and abnormal? So think about what's going on. Nurses are exceptionally good at the patient experience. Do they feel better or worse? How are they responding to treatment? We are going to do something for them, and how are they responding to that? Our goal is to maximize their independence. This is all based on the human caring theory. This is nurses are always going to step in and do something rather than pushing the patient to do as much as possible for themselves, right? That's one theory where nurses always do the thing for the patient. They don't ever push the patient. This model of resuming the independent functioning to the greatest possible level, this is based off of the self-care deficit theory by Dorothy Oram. This is saying that my job is not to do all the things for you. My job is to help you do as much for yourself as you possibly can. Okay, this is the brain fight. All of this, what we're talking about, what we're going through, this is what you're trying to do, because you're poking the brain and you're trying to push it to think about things in a way that is very different from anything you've ever thought about thinking about it. This is the nurse brain versus the human brain. This is me wanting you to think about how a patient experiences something and how they respond to something. And how do I turn that information into making the patient better and leaving them better than I found them. And once you start this process, you can't really turn it off, right? Like, you're going to make yourself very uncomfortable in your thought process. And I want you to lean into that, because I want you to go through that brain fight so that you can think about what it is that you are trying to accomplish for your patient and how you accomplish that. This is the entire point of nursing school. Wow, hang tight. Okay, so the whole point of nursing school is how to stop thinking like a human and start thinking like a nurse. What we do, we assess, we diagnose or analyze, we plan, we implement, and evaluate. This is something that we have gone over extensively in health assessment, and I know that this is something you have all learned, right? So now we're going to start applying this, and we're going to start looking at how we actually do this and what that actually looks like. This is how we do nursing. This is the entire point of nursing school, is learning how to do exactly this. My computer is being a little buggy. Bear with me. Maybe. No. Okay. Okay, so the nursing process. This is what we do, right? This is what we're doing. Step one is maybe assessment. This is what you learned in quarter one, right? We learned about assessment in quarter one. You know how to do this. Gathering information about our patient's condition. That's what we're doing. This is how are they showing up to us? And then what are we compelled to do based on those 3 levels of evidence to do for the patient? This is the most important part of the entire nursing process, is the assessment. You have to do this. You cannot do nursing from behind a computer. You cannot do nursing from across the hallway or from the lab work, right? You have to be in the patient's room doing a physical exam, finding a way to organize this and make it flow and be consistent so that you can do it the same way every time, that head to toe assessment. And by doing so, when we're doing our physical exam, we're then going to do a thorough focus exam about whatever is abnormal. So if we find an abnormality during our brief head to toe, we're then going to go back and do a focus exam on that thing that is abnormal, right? And the reason we're doing this is so that we can gather those 3 pieces of evidence that compel us to action. We need 3 pieces of evidence or data that tell us, okay, we truly have a problem and I am now compelled to do something about it and I'm now going to take action. And that's what we're trying to do, is that piece. This is the most important part of the nursing process. That's why you spend an entire quarter on it. When we think about the nursing process, this is a continuous process. It is not linear, right? This isn't something that we are just going to do and then be done with. It is never ending. This is the song that never ends. This is the thing that you are going to be doing until the end of your career. This is something that you go through every single time you go in the room. You assess your patient. You diagnose, which is identifying the patient's problems. That's all it is, right? Remember that you're diagnosing or you're analyzing. That is not a medical diagnosis. That is a nursing diagnosis. Those are those NANDAs that we're going to talk about lots this quarter. This is planning, setting a goal or our plan of care, our outcomes that we are trying to achieve for our patient, and then identifying the actions that are going to help us get there. Implementing. This is most of the actual physical time that we spend in the nursing room is spent during implementation, because we actually are doing things, right? And then evaluating. The whole purpose of evaluation is to figure out, okay, the goals that I had, were they achieved? And if they were achieved, what of my interventions helped them to be achieved? If they were not achieved, why not? And what do I need to do differently? And then we're going to start all over again, and we're going to assess and gather more information about the patient's condition. And again, you cannot do this from behind the computer. You have to be doing this from the bedside. That's the only way we're going to do this. That is our nursing process. All right, assessment. Let's beat a dead horse. So we're going to collect some information from a source, right? So any source that helps us to form an understanding of why the patient is seeking assistance with their health. This is both types of data are composed of the assessment. We have several sources for gathering data. We have our patient interview. This is when you talk to your patient. You ask them a million questions. When you have run out of questions to ask them, that is when you start your physical exam. We always want to use open-ended questions. This is one of the most important things we can do, is use open-ended questions. This is the phrase, tell me more about that. And that is going to become your favorite phrase, because the point at which it's awkward and now you're like, there's nothing more for them to tell me about that. Okay, excellent. You have completed your interview. You know all the things that they have to tell you, but you want to know literally all the things that they have to tell you. This is also the family interview, right? We could be interviewing the family rather than the patient, depending on the patient demographic and their cognitive abilities or what's going on with them. And then we're going to do our physical exam, because now we've asked all the questions and we know all the things. So now we're going to jump into our physical exam. This is all of health assessment. This is our brief head to toe screening. So first, we're going to do our head to toe exam. This is what you do on every patient for the rest of your career. Literally, every single patient for the rest of your career, you do a head to toe screening exam. You are going to find abnormal things. It doesn't matter. Go ahead and complete your head to toe. After you complete your head to toe, now you're going to go back and do a focused exam on the body systems where you found something abnormal, right? So if we have a patient who's coughing during our head to toe, what focused exam are you going to do? We're not going to listen to their lungs. We're going to do a complete respiratory exam, right? Not just listening to their lungs, a complete respiratory exam. Think about what body system doesn't work. It now needs a focused exam. And then this is the whole point of this is putting all of those skills that you learned during health assessment, is putting all of those to work, right? That's the whole goal of this. Now we have our actual data. So think about what data is available. This is your EMR. This is your medical record for the patient. we want to go and mine the chart and find data in the EMR that can support what we've just found when examining our patient. We cannot nurse from a computer. We need to go see our patient and see them a lot to be good at this job. But we do still want 3 levels of evidence. We need 3 levels of evidence to compel us. One is from the interview, one is probably from the physical exam, and then one is probably from our data sources that gives us that 3rd level of evidence that says, okay, we definitely have a problem. When you are thinking about your sources, we also have active observation. This is something that we do, right? We want to prove that something is wrong. This is our active observation. This is the things that we went into the room and we sought out that information. We had a suspicion for something that was wrong. We went in the room, we sought this out very, very specifically. Then we also have our passive observation. These are the things that we didn't go looking for them. It just kind of happened. This is when we are doing our brief head to toe and the patient coughs in our face, right? And then we notice that they are short of breath. So then we take an x-ray and we find a tumor. I want you to go ahead and pause this video and click on this example in your PowerPoint and go ahead and watch this video and then hop back in and we'll kind of discuss it a little bit and talk about what it is that we're seeing. Okay, so in this video, the nurse is examining a patient, right? So what information is the nurse actively seeking? Well, she went in seeking to verify the patient. All she went looking for, the thing that we saw her actually doing was looking at the patient's name band and verifying who it was. And then she also assessed level of consciousness, right? So she did check that she identified the patient and she checked the level of consciousness. Those were the only things that she did in active observation. What were the things that you noticed by passive observation? So what did you see the patient doing? You notice that he was restless, he was having hallucinations, he was climbing out of bed, right? He had tactile, auditory, and visual hallucinations. Those are the differences between passive and active observations. Or what did you specifically go looking for, and what did you just happen to notice while you were there? Okay, moving on in our assessment data. So our assessment is going to be broken down into 2 types of assessments. We have our admission assessment. This is the giant one that we learned in literally the entire course of health assessment. This is, we have a new patient who has come in. The first thing we do is ABCs because we need to know whether or not a patient is breathing, right? If your patient's dead, it doesn't actually matter if you get all the way to the labs or to the comprehensive medical history. If they're not breathing, it doesn't matter. ABCs are first, always. So we're always going to prioritize that. The next thing we're going to do is the review of systems. Remember, this is your subjective data. So this is your history of present illness. This is their complete medical history that we get from their personal and their family history, right? And then we're going to go to our current medication reconciliation because I want to know what meds this patient's on. You can tell a lot about a patient's medical history based off of what meds they're on. And then I'm going to do a focus exam. Our focus exam is going to be done on anything that we discovered abnormalities with. So any systems that were not normal in this, we are then going to do a focus assessment on. Then we have our ongoing assessments. Our ongoing assessments are going to be the assessments that we do, again, every day of life from now until eternity. Again, ABCs first. Don't assess a dead person. That is a waste of time. We need to make sure our patient is alive before we move forward. Then we're going to do our head to toe. This is our broad survey. What is going on with a patient that I know nothing about? This gives us a baseline status of the patient, right? This tells us, okay, this is where we're starting at. Then we're going to do our focus exam. The focus exam is going to give us a secondary level of evidence. This is any system that had an abnormality in the head to toe or in the ABCs gets a focus exam. This is going to give us more information and more data. Step 3, now we're going to go mine the chart. Go through the data and find additional data to find and support your findings. These are our labs, our medications that they're on, the diagnostics. This is finding everything else that helps to support where we're at. Keep in mind that you are a novice nurse. You are supposed to be a novice nurse right now. You have never done this before. Because of this, it is completely unreasonable for anyone to expect you to walk into a room and to be able to do these proficiently. When you go in the room, I want you to go through these steps one by one. Nurses do ABCs during rounding and handoff, right? When they go and do handoff at the bedside, one of the things they're doing is checking ABCs and seeing whether or not the patient's still breathing. And then the next time you go in, I want you to do a head to toe. So practice nurses are really, really good at doing a brief head to toe and then going straight into their focus exam, and often blending these and doing their assessment passively. Do not use their exam for how you do yours as a model for how you do yours. What I want you to do is actually step out of the room and organize your thoughts and do some critical thinking, right? So go in and do your ABCs and then come out of the room. Do some thinking about what you want to focus on. Go back in, collect your thoughts, know what assessment order you're going to do your brief head to toe in. Go back in the room, do your brief head to toe. Do it in that consistent manner that you do it every time, that nice practice, smooth method. Then step back out of the room, organize your thoughts, do some critical thinking. Which systems are abnormal? Now go back in the room and do those focused exams. And then when you leave, go back and do your data review. As a new nurse, it's also an excellent idea to take your health assessment workbook to clinicals, because in between every patient, you can actually go and brush up on what you want to remember and what you want to focus on. Use your tools that you have available to you. You have subjective and objective pages from each chapter from health assessment that are a great review of what you actually want to do for these assessments. And it's a really good way to kind of ground yourself and think about how you want to dive into this. All right, this is flat drawn. This is who we are going to be working on for the rest of this lecture and day 2 lecture. So pause the video, and I want you to think about what can you assess just from this picture. What subjective data can you gather? What objective data can you gather, right? So what subjective data is he potentially reporting? What objective data can you notice just by looking at this picture? Go ahead and pause the video and think about your subjective and objective assessment data.